Oh, does that mean we're people or?
We're live now, so people can enter, but I got to press the start broadcast. That will start recording the session.
Oh, I see.
Yeah. Okay, you're good to go.
Great. So I guess we'll wait just a couple of seconds and give people an opportunity to make it into our room, maybe just a minute or so.
Sounds good.
Let's see. We have a good group of people already. Good morning, everyone. We're going to get started here in just giving people a chance to arrive. Okay, since we don't have a full hour, we're going to go ahead and get started since it's 10:01. Hi, everybody. Thank you so much for joining us today to hear about quality for COVID-19 and beyond. Next slide. My name is Aleli Baños-Keener. I'm the Indoor Air and Asthma Coordinator for EPA Region 9. And joining me today is Mansell Nelson, Program Manager for the Institute of Tribal Environmental Professionals, or ITEP, in the Tribal Communities Environmental Education and Outreach Program. We also have my EPA colleague, Sarah Sullivan, our Children's Environmental Health and Healthy Schools Coordinator, and Eileen Shanahan, our Environmental Education Coordinator. Wanted to remind everyone that the slides for this presentation are posted to the session website, and we encourage everyone to download them for reference and to access the links with additional information. Next slide. So here's a quick review of the topics that we're going to cover today. We're going to start with the importance of indoor air quality, ventilation, and filtration, including unproven technologies to be aware of. We're going to talk about sensors and monitors, and then funding and resources, and then we're going to open it up for questions. At any time during the presentation, please feel free to ask questions in the chat box, and we'll answer them. And I'm going to start us off by talking about the importance of indoor air quality. So next slide, please. Okay, so let's talk about indoor air quality by starting with this very obvious but clear and true statement about air. You could go days without food and hours without water, but you would only last a few minutes without air. So this is a very true statement. And what is also very true about it is that we think a lot about food and a lot about water. I think probably many times a day. I know I do. But we rarely think about the quality of the air that we're breathing, especially indoors. The quality of the air we breathe is extremely important, as well as the things that we can do to make our indoor air as healthy as possible. Studies have shown that people that are affected by air pollution are disproportionately Black, Indigenous, of color communities, and low income and people living in poverty. Next slide, please. Okay, a few other major reasons why our indoor air is so important is that we spend a lot of our time indoors. Studies in the US and Europe show that people spend approximately 90% of their time indoors. To put this in perspective, that means that we spend less than two and a half hours a day outside. Another important fact is that studies also show that the indoor air that we breathe can be 2 to 5 times more polluted, and sometimes up to 100 times more polluted than outdoor air. So our indoor air is a combination of things, whatever is happening outside, whether it's rush hour traffic or smoke from a fire, and whatever is happening. This could be cooking, furniture, or carpeting off-gassing. It could be the presence of mold or dust mites, or even radon. Poor indoor air quality affects all of us, but especially vulnerable. So the elderly, medically vulnerable people with health conditions such as asthma, heart and lung disease, and especially children because they're still growing and their organs and bodies are still developing. So these environmental pollutants can have lifelong effects in children. Next slide. Some of the health effects of indoor air pollution can be immediate, like triggering an asthma attack or irritating your eyes, throat, and nose. It can cause headaches and fatigue. It can even cause death in some extreme in very serious cases, such as with carbon monoxide exposure. But indoor air can also have long-term effects that can appear years after exposure. The National Ambient Air Quality Standards established back in 1970, air pollution was seen primarily as a threat to respiratory health. But over decades, we've seen research on air pollution that has shown that it's linked not only to respiratory health, but also to cardiovascular disease, diabetes, obesity, and reproductive, neurological, and immune system disorders. Indoor air affects your health even if symptoms are not immediately noticeable. Next slide, please. So let's talk about indoor air quality in the classroom. A school's core mission is to educate children, and research shows that a school's physical environment can play a role in academic performance. Problems such as leaky roofs, insufficient cleaning or excessive cleaning, problems with heating and ventilation and air conditioning systems, all of these other maintenance issues can trigger health problems like asthma and allergies. It can increase absenteeism and reduce academic performance. There's also evidence diesel exhaust from school buses and other vehicles can exacerbate asthma and allergies. 17.8% of Native and Alaska Native children have been diagnosed with asthma in the US. And asthma is the leading cause for school absenteeism. There's also a lot of evidence showing that indoor environmental exposure in schools play a role in triggering asthma symptoms. So COVID has made the need for improved indoor air even more, especially the importance of ventilation and filtration, and we're going to talk about that here in a second. So making improvements in indoor air quality in schools will help children and staff feel safe and comfortable at school, will help children learn, and it will also assist when there are COVID exposures in the classroom. So now I'm going to turn it over to my colleague, Sarah Sullivan.
Thank you, Ollie, for that overview of indoor air quality. My name is Sarah Sullivan. I am the Children's Environmental Health and Healthy Schools Coordinator for EPA Region 9. I provide technical assistance, education and training, and outreach to the public to keep children healthy and safe where they live, learn, and play. I also collaborate with other EPA programs and work with external organizations on research, outreach, and other projects related to children's environmental health through partnership agreements, grants, and contracts. I'm originally from Michigan, but about a year ago, I moved out to Alameda, California. I'm going to provide an overview of ventilation and filtration best practices, including for the COVID context, and talk a bit about how indoor air quality relates to cleaning and disinfecting. As the research on the pandemic has progressed, we've learned more and more about SARS-CoV-2, the virus that causes COVID-19, and how it is transmitted. The early research suggested transmission from surfaces was a significant concern, but research from the CDC now indicates that airborne is the primary way the virus is transmitted. SARS-CoV-2 is transmitted primarily in droplets and aerosols. Droplets are heavier and fall to the ground, and aerosols are lighter and can travel in air farther and last in the air longer than droplets. In order to reduce the spread of infection, the best approach is to use a combination of different strategies known as the layered risk reduction approach. Our presentation today will talk mostly about ventilation and filtration, and we'll touch just briefly on disinfection. But it's important to continue all of these practices in schools and other facilities, and even at home, to mitigate risk. We have just a short amount of time together today, so I'm going to very briefly cover basics about ventilation and filtration and some best practices. More in-depth information can be found in the resources we're providing in this PowerPoint, which you can access on the Tribal Conference webpage. Ventilation is an important way to remove particles from the air, including airborne viruses. Both mechanical and passive ventilation provide fresh air by diluting and removing some or all infectious airborne microbes. Mechanical ventilation uses the building's heating, ventilation, and air conditioning systems, or better known as HVAC systems. Buildings with and without HVAC systems also rely on passive ventilation, which is opening doors and windows. Ventilation often refers to air exchanges per hour, a rate that calculates how often the volume of air in a given room is replaced by new air. There's currently no standard for this, but 5 total air exchanges per hour or greater is recommended by some experts to achieve quote-unquote excellent ventilation. Harvard and the University of Colorado teamed up to create an air exchange calculator you can use to estimate the air exchanges per hour in a given space. That's linked here for you to check out. And Mansell will talk more about carbon dioxide parts per million and how you can also use that to measure ventilation. Filtration is another way to improve the indoor air quality and lower the risk of transmitting airborne disease. Minimum Efficiency Reporting Values, or MERV, reports a filter's ability to capture particles. Filters with MERV 13 or higher ratings can trap smaller particles, including viruses. Upgrading to a MERV 13 rated filter, or the highest rated filter that your HVAC system can handle, could improve the system's efficacy in removing viruses from circulated air. But before making any changes to the air filter in an HVAC system, you should contact an HVAC professional. Not all HVAC systems can support a higher MERV rating. A 2020 report by the U.S. Government Accountability Office estimates that 41% of school districts need to update or replace the HVAC systems in at least half of their schools. That's about 36,000 schools that are requiring an update or replacement. We'll talk later in the presentation about some funding sources available to help upgrade school HVAC systems to improve indoor air quality. It's very important to ensure the HVAC filter is correctly in place or air could come in around it. Also consider running the system fan for longer times or continuously because HVAC systems only filter the air when the fan is running. Many systems can be set to run the fan even if you're not heating or cooling. Another measure that's helpful is opening the outside air intake if your system has one. Bringing outside air in through the system rather than by opening windows and doors will ensure that it passes through the filter. If you rely on opening in doors and windows, it may also unbalance the HVAC system or have other unforeseen consequences. But if you feel like you need to open doors and windows, maybe based on carbon dioxide measurements, for example, which we'll talk more about, then it's important to do that. Portable air filters or air cleaners are an effective way to filter air in individual rooms, especially if HVAC systems are inadequate or you don't have one. There are no standards for testing or rating portable air filters, but there are criteria to look for to ensure you're using the best and safest filters for your space. First, you want to make sure you have a true HEPA filter. Some air cleaners also include an activated charcoal filter, but these are primarily for gaseous pollutants. So what you want to make sure you have is that HEPA filter to capture particles. It's also important to check the clean air delivery rate and the room size that the unit can filter. Electronic air cleaners that use ionization and/or emit ozone are not recommended, as those can contribute to poor air quality, even though the point is to try and improve the air quality. The California Air Resources Board, or CARB, maintains a list of air cleaners that meet their criteria for safety. Portable air cleaners do require some expense, but a fairly inexpensive approach is to create a portable air cleaner using a regular box fan and MERV 13 filter that you can buy at the hardware store. EPA has been conducting research on both the safety and efficacy of these do-it-yourself filters, which you can read more about on EPA's website. Much of the guidance around air quality for COVID-19 involves bringing in outside air. But what if the air quality outside is poor from wildfires, vehicle exhaust, or other sources? What if the temperature outside is extremely cold or hot? Poor outdoor air quality and temperature differences can make it really hard to safely ventilate. So that's why it's important to use both ventilation and filtration in partnership. If the outdoor air quality is poor, you should close outdoor intakes if possible and keep windows and doors closed. In this case, you'll rely more heavily on filtration. You can use airnow.gov to check the air quality index in your area to determine how safe the outdoor air quality is. This overview is very short and doesn't cover all of the challenges that administrators, facility managers, and communities have, from managing the noise level in a classroom to keeping costs down to whether the control of the HVAC is even at the school or if there's a contractor that's controlling the system. There are a lot of choices and compromise when it comes to keeping indoor air quality healthy, and some of those are judgment calls that come with time and experience. Mansel's portion of our presentation in just a few minutes will give you tools to help you make more informed decisions to protect schools and improve indoor air quality. I want to touch just briefly on disinfection and how it relates to the layered risk approach and air quality as well. Research shows that the risk of transmission from surfaces is low, but people continue to use, overuse, and misuse cleaners and disinfectants. Many products used to clean, sanitize, and disinfect contain toxic chemicals. Disinfectant residues left on a surface can become airborne and inhaled, and some health effects from these products are immediate, like an asthma attack or eye and skin irritation, but some health effects may not show up for years or even decades, such as cancer, reproductive disorders, and central nervous system impairment. Aerosol disinfectant sales by Reckitt Benckiser went up over 100% in 2020. We've also seen a large increase in poison control calls to report exposures due to cleaning and disinfectant products. People who were unable to find their regular products when there were some shortages early on in the pandemic decided to mix their own, resulting in toxic gases that can severely harm or even kill. You should never mix products unless the product label specifically tells you how. EPA has two great programs that can help you find the best products for you, both for home and for school. The first is the Safer Choice program for cleaning products, and the second is the Design for the Environment program for disinfectants. You can use these websites to search for the right products, including those that are fragrance-free for chemically sensitive people, such as those with asthma. Look for the label on these products where you buy your cleaning and disinfecting products. You should ensure the products that you're using are meant for school settings. Always follow the label instructions and make sure the space you're cleaning or disinfecting is well ventilated. To limit the amount of product in the air, you can also spray the product in a stream on a microfiber towel and then apply it to surfaces rather than spraying the surface directly. A quick note on bleach. Bleach has intense fumes that can exacerbate or even potentially cause asthma. Children are at greater risk from breathing bleach vapors because their lungs are still developing. Unless there's a specific need for it, bleach is really best avoided. If you're going to use it, like all disinfectant products, please make sure that you have the appropriate personal protective equipment, or PPE, to protect yourself and anyone around you. EPA has a really wonderful guidance document with simple information for safely cleaning and disinfecting. Like our guidance in the rest of the presentation, these are best practices for every day, not just for the pandemic. One thing I talk about a lot that often surprises people is you should not be asking children to use disinfectants, including wipes. Sometimes schools ask students to disinfect their workspaces, and children are still growing and developing, and chemical exposures that may not have an effect on an adult can have a long-term effect on children. And I don't just mean really young children. That's often what people think. They think, oh, well, kindergartners shouldn't be using these then. The EPA Office of Children's Health Protection defines children through the age of 21. So please don't ask students to use disinfecting wipes. Having 30 kids wipe down their desks with disinfectant wipes is an air quality issue, among other issues. That's a lot of fumes that these children are breathing in. I want to take just a minute to talk more specifically about wipes. Disposable wipes may look similar, but they come in very different forms designed for very different uses, and they cannot be used interchangeably. Wipes also come with different directions for how to use them. I want to talk through just a couple of examples of how confusing these products can be. So A on the slide is an EPA-registered surface sanitizing wipe that can be used on food contact surfaces and are meant for killing bacteria, not viruses. The instructions for these particular wipes indicate they should be used so the surface remains wet for a 30-second contact time, which may take multiple wipes. B is an EPA-registered disinfectant wipe for non-food contact surfaces for killing both bacteria and viruses. For these wipes, they should be used so the surface remains wet for a 4-minute contact time, and hands must be washed well with soap and water, even if chemically resistant gloves are used. C is an FDA-regulated hand sanitizing wipe. These are over-the-counter products for your hands and are not designed for cleaning surfaces. One thing they do all have in common is these products all carry a keep out of reach of children warning. This is another example. Both of the products on the slide are labeled as alcohol wipes, but the product on the left is an EPA-regulated disinfectant for surfaces, and the product on the right is an FDA-regulated hand wipe product. So it's very important to look carefully at what you're buying and using and ensure you're following the directions and using them correctly. On the webpage for our session today, you'll see a PDF from the University of Arizona with more information about wipes. So now I want to turn it over to Mansell Nelson to talk a little bit more about IAQ in schools.
Thank you, Sarah. A lot of good information so far, and I hope to contribute to the conversation. Next slide, please. For those of you who don't know me, I'm a program manager with the Institute for Tribal Environmental Professionals, and I'm glad to be co-presenting with our EPA partners out of Region 9 today. Our organization serves all 574 federally recognized tribes, so I get to work nationwide. But we are located here in Flagstaff, Arizona, which is part of Region 9. Next slide, please. So I'm going to focus on avoiding unproven technologies. Sarah already talked a little bit about filtration and air cleaning, but I'm going to focus on some technologies that vendors are aggressively selling right now. Next slide, please. So this is a slide from an EPA presentation a month or so ago. And in that presentation, they talked about a variety of different air cleaning technologies, but this slide summarizes the different technologies that we're seeing. One has been categorized as subtractive technologies. This is basically filtration. This is a well-established technology, well-proven. We know that it works under a variety of conditions, and it does not add hazardous chemicals to the air. Then there's the general category of additive technologies, and these have been very popular during the pandemic. Vendors have been very aggressive at marketing these and in tribal communities as well. And they add chemicals to the air with the hypothesis that they degrade or destroy various chemicals. I emphasize that that's a hypothesis. It's currently being investigated by EPA researchers, and so far, they don't have very good evidence that these actually work. And in fact, in some cases, testing has demonstrated that they actually add more pollutants to the air. So we really encourage people to stick with the subtractive technologies. If you want more information, there's a link at the bottom there that will take you to an EPA website discussing more about air cleaning technologies. Next slide, please. One of the technologies that has seemed to be particularly popular is the bipolar ionization. They market and advertise that they can destroy the SARS-CoV-2. So EPA actually set up a test chamber. I might add a room-sized test chamber. And this chart is showing the efficacy of this claim. And you'll notice that the blue bar and the gray bar are pretty close to the same. The gray bar being the control and the blue bar being the adding of the bipolar ionization device. Basically, no efficacy. One of the challenges here is much of the marketing information is based on lab scale, bench level testing, and have not been tested in full sized room applications, which is what the EPA scientists are working on. You can watch the recordings of some of these webinars at the link that's provided at the bottom. They go into a lot of detail, but bottom line is so far we're pretty skeptical about these ionization technologies. Next slide, please. So one of the popular devices, of course, is the portable air purifiers with ultraviolet light. And ultraviolet light is known to work if used properly for killing viruses. However, in the portable air purifier application, they're taking technology that's known to work and then applying it in a way that it often does not work. Airflow is often too fast. They don't always have the correct wavelength for the UV light. In different situations, particularly where there's high VOCs, you could end up with ozone, either in trace amounts or more. And of course, UV light, if not used carefully, can burn your skin or damage your eyes. So we do not recommend at this point using UV with the portable air filters. Next slide, please. Another way that people have looked at trying to clean the air is electrostatic sprayers. Electrostatic sprayers are actually designed for cleaning surfaces. They're not approved for air cleaning. There's no evidence of efficacy in air cleaning. Besides that, as Sarah mentioned, we don't think that surfaces are the primary transfer. Next slide, please. If you are going to use electrostatic sprayers for cleaning, there's a lot of precautions that should be taken. And probably the biggest one is they should be used only in unoccupied areas. And of course, the applicator should have proper PPE to protect themselves. As Sarah has mentioned, we want to follow labels. We want to be careful about food and children. And we want to ventilate the area very well before occupying. So these electrostatic sprayers are just not effective for cleaning air. Next slide, please. So I did mention that UV can be used. It's used frequently in hospitals. The picture is showing an application in an unoccupied hospital room. You want to have qualified engineers to help you with design and installation of UV and be very aware of safety and effectiveness. Next slide, please. So just a final slide on different types of air cleaners available. And this category is more that whether they're portable or in-duct cleaners. There's also a picture there of the DIY that Sarah mentioned on one of her presentations. The far right, you see an application of UV lamps. These same technologies can also be applied in duct. So, if you're doing an HVAC upgrade, you might look at some of the technologies for in-duct air cleaning. Next slide, please. So one of the key issues I have found working with schools is the fact that you can't see the air. And as Sarah and Ali both mentioned, we oftentimes don't pay attention to the air because we can't see it. And so I'm a big advocate of seeing the unseen. Next slide, please. And we do this through various sensors. There are 2 states that have started implementing ventilation monitoring, and I'm very pleased about this, but of course we have 48 more states to go. But these 2 states are Region 9 states. Region 9 is leading the way in implementing ventilation monitoring. The state of California uses CO2. Every classroom is supposed to have a CO2 monitor. And there's an alert system anytime that 1100 ppm is exceeded. The state of Nevada also requires monitoring the CO2 in the classrooms. Next slide, please. So we'll talk a little bit about the technologies that are being used. And of course, carbon dioxide is not a direct measurement of air pollutions. That's definitely one of its limitations. It's also not very effective for testing ventilation in an unoccupied room. Oftentimes when I'm working with schools, they want me to come before or after school to do the testing because they don't want to disrupt classes. But these carbon dioxide measurements need to be taken during occupied periods of use in order to effectively measure the ventilation. And but it's very quick. It doesn't take a lot of time. It can be continuous if you put a device in the room. It's relatively inexpensive compared to, other things that you can spend money on. And it is a good surrogate for air pollutants, because if your carbon dioxide is building up, then so are your other air pollutants. Next slide, please. So, of course, if you're going to measure, then you need to know what numbers you're looking for. Pre-pandemic, we used about 1100 as our guide, although I should emphasize this is only if our only pollutant is people, body odor. If you have other pollutants, then CO2 is not necessarily a good way to evaluate your ventilation. You may need to significantly increase ventilation. For example, a smoking casino, I would not use 1100 as a guideline. During the pandemic, we would definitely recommend increasing ventilation in order to provide better protection from the virus. And you'll see a variety of sources recommending different levels. This comes from a group at Harvard, and I would definitely recommend targeting the 700 ppm, but any level below 1100 is an improvement. Next slide, please. These are just examples of some of the technologies. These are 2 that I happen to have used and use on a regular basis. These are a little bit on the higher cost end. Next slide, please. But we've now recently had some low-cost sensors that have come out. And there was a question earlier from Ted about using them in homes. These are actually a consumer product that is intended to be used in homes. But of course, it could also be used in a classroom. And these are examples. I'm not recommending these devices. They happen to be some that I've been exploring. But there's actually a lot of different devices available on the market. Next slide, please. And then another measurement that we want to make. So carbon dioxide helps us measure the ventilation. But if we're using filtration, what do we measure then? Well, we can measure the PM. Again, it's a quick estimate of the effectiveness of the filtration. And we know that SARS-CoV-2 is a particle. These measurements, however, will not be measuring directly the SARS-CoV level. By the way, it can also be effective in wildfire events, both inside and outside, to give us a gauge of what's going on for that. There are a lot of sources of PM, and the meter only measures in general PM. Next slide, please. So again, some numbers. There are no standards for indoor air, and this is a relatively new area as far as looking at guidelines. I did put the outdoor air standards here. However, if we're trying to protect people from SARS-CoV-2, I would not want to approach those levels. Basically, lower is better. I would go for essentially 0 or non-detect for my PM levels. But of course, you'll need to compare inside and outside. If you have good filtration in your HVAC, you should be dropping the PM considerably. If you're using mobile filtration in a classroom, that should drop your PM levels even further. Next slide, please. So a couple of examples and some prices. You can see that with the low-cost sensors, we've gotten down to pretty inexpensive. The wind tracker is basically a personal monitor. I've been using it a fair amount, and I have found it useful for helping me manage ventilation in my own home. Next slide, please. The other device, a little more expensive, but has pretty good sensitivity. So we have a raffle. If you can type your emails, name, and organization in the chat, I will collect those, and we will randomly select a winner for a wind tracker. And so you'll be able to test out the device yourself and decide whether or not it's something that you would find useful in your work. So give us your name, organization, and email in the chat, and we will select a winner for a raffle. Next slide, please. So another PM monitor. This one's being used in a Region 5 project as well as some Region 9 projects. I provided the YouTube link for this particular one, and I'm sharing this because it's being used in various projects. Next slide, please. If you want more examples, you can go to the Air Sensor Toolbox. I wanted to mention purple airs because they've become very popular, especially for wildfire smoke. And there's devices for monitoring both inside and outside. And if you're curious about the data that's being collected, you can go to the purple air map and see how they're being used nationwide. Again, this is not an endorsement of this particular device. It's just that it's become one of the most popular ones for a variety of different projects, including citizen science projects. Next slide, please. And then finally, since we can't see air, another device I use is a smoke puffer. It does actually put a small amount of smoke in the air. It is a pollutant, so we don't want to get carried away with this, but it does allow us to see the air movement. And this can help us determine airflows, for example, in and out of a classroom, check the exhaust fans, etc. Oftentimes, when Sarah was talking about opening windows, it depends on the air pressures within the building as to whether or not air is flowing in or out. If it's flowing out of the classroom, you might actually be bringing more contaminated air from the entire building into your classroom. So it is valuable to know which way air is moving because you want to make sure the air is moving from clean to dirty to out. Next slide, please. And so it's not a quantitative measurement. There are other devices if you want to quantify these pressures. And as I mentioned, clean to dirty to out. Next slide, please. And just a picture of one device. Again, there's many different devices for producing smoke. I chose this particular device because it is a non-toxic smoke. At one point, I was investigating a school, and I was using one that uses titanium chloride, which when reacts with water produces titanium dioxide, and hydrochloric acid. And if a child were to put their finger in the detection unit, they'd get a pretty good chemical burn. So I was in pretty much a panic mode until I found my smoke puffer and got it back under control. And at that point, made the decision I was never going to take one back into a school environment. So I use this one. The oil, of course, can be an irritant, but students could drink it and there wouldn't be any ill effects other than maybe a little diarrhea. Next slide, please. So in summary, there are various devices that we can use to see the unseen. And my experience working in schools, which is over a decade now, by using these measurements, I can give feedback to school administrators. I can let them know how their ventilation is doing. We can assess whether or not filtration is adequate. And with the smoke puffer, we can identify air movements throughout the building, thus seeing the unseen. Next slide, please. My contact information, and I'm going to turn over to our next presenter, which I think is Ali, to wrap up. Next slide, please.
Yes, thank you, Mansell. Okay, so we want to talk a little bit about funding considerations. Now that Mansell has given us such great information about all these neat instruments that you can use to measure your indoor air quality. I know many of you are familiar with the GAP program. Some of you may be new to the GAP program. So I added a link here to this first bullet on developing indoor air programs that we gave during last year's EPA Tribal Conference, and has a lot of good information about the GAP program if you're just learning. So wanted to point out that in terms of funding, if you have a well-planned and thought out indoor air component in your GAP work plan, adding equipment to that plan is definitely a possibility. And when I say equipment, there's like this federal government about equipment being over $5,000. It's actually, most of these items that Mansell described are under $5,000. So they're actually considered supplies, not equipment. So just keep that in mind when you're applying for your grant. So as long as you have a very well thought out program, you are showing how the used along with your indoor air program that you're developing, you can definitely add this to your GAP work plan. And of course, it's up to your GAP project officer, and it also depends on how much funding is available through the GAP program, whether or not those requests are going to be approved. The second thing that I added here is the Tribal Healthy Homes Network has a funding compilation on their website. I added 2 links here. So again, we encourage you to download the presentation so that you have access to all of these links. The general link has a lot of different air-related funding, and then there's another indoor air funding specific link. And then the third item that we wanted to point out is that there's funding available through the American Rescue Plan for indoor air quality, and there's a couple of links here that you can access as well. The second link has a compilation. It's actually a link to a message that came out from EPA, the Indoor Environments Division, and has a lot of great information on that you could consider using the ARP funding. The Department of Education, EPA as well, on ways to use the funding towards indoor air quality. And next slide. So we are about 5 minutes, and we're gonna answer questions here in a second, but we wanted to also share these resources with you very quickly, just to point out a couple of them. I think Mansell already mentioned that the EPA Indoor Air Quality in Schools website has recorded webinars with a lot of great information on what COVID and different instruments as well from a lot of HVAC professionals. So if you want to, do some capacity building, like through the GAP program, for example, viewing those webinars, adding that to your work plan to build your capacity, that's a great activity that you could focus on. There's a great website on indoor air and coronavirus as well. The Western States Pediatric Environmental Health Specialty Units have a lot of great information on the website as well. So we encourage you to just check out these different websites for more information. And next slide, I'm going to turn it over to my colleague Eileen Shanahan to talk about environmental education.
Great, thank you. Hi everyone, my name is Eileen and I'm the Environmental Education Coordinator with Region 9 EPA. So how does environmental education connect to these issues? Educating students and parents and the public about air quality allows people to engage with environmental issues, practice problem solving, and take action to protect the environment and their communities. And it gives people the opportunity to make informed and responsible decisions. So to learn more about environmental education and air quality opportunities, please consider joining our presentation just following this presentation from 11 to 11:50. And Menzel Nelson and my colleague Ryder Freed and I will be presenting about a variety of environmental education opportunities. So thank you for joining this presentation, and we hope to see you at the next, but I think we'll have time for questions now. So yeah, please feel free to write in the chat any questions that you might have.
Thank you, Eileen.
Yeah, thank you, Mansell. Thank you, Ahili. Thank you, Eileen and Sarah. It was a great presentation. I think Ted's question was answered by Mansell, if that's correct. If not, please let us know in the chats. Janice had a comment about bleach, which then was answered with preceding information. And then thank you, Lori, for providing that link for Safer Choices. We have a few minutes left, and if you have any questions, let us know, or comment, or just want to say thank you, or have a good day, whatever you want to do. I was happy to see all those submissions for the raffle, so that's pretty cool.
I was able to get all the names for the raffle, and but I did. A couple people looked like they might have tried to submit, but I didn't have an email. One was Yolanda Cortez.
She's further down. She added it later.
Oh, okay. All right.
She's in there twice because she updated with.
Okay, then I probably captured it. Thank you.
Yep.
And then there was one email that didn't look like it was an email. I think it just had an extra letter at the end. But if you could verify it, it would be appreciated. And we'd also encourage any questions. As is pointed out, I responded to the question about devices for indoor air in homes. Any of the devices that I talked about using in schools can also be used in a home environment, and we conduct trainings through ITEP to help tribal professionals learn about the different measurements and how it can be used to help you look at a home environment or a school environment.
Thank you, Nancy. Yeah, that's great.
I wanted to add, there was a question from Ted Pwetz asking about indoor air testing kits. And we talked about sensors, but what comes to mind for me is a radon indoor air test kit. And those are definitely recommended. Radon is the second leading cause of lung cancer. And when I learned that statistic, it was just mind-blowing to me. Next to tobacco, it's the second leading cause of lung cancer. So it's definitely recommended that if you haven't already tested your home for radon, that you do that. And the test kits are like $20. You order them online, I think, or probably can get them at a hardware store, and you use them to test for radon. I think there's also sensors that test for radon, right, Mansell? I know I've asked you this question before, but the test kits seem to be sort of an easy way to go as well.
Yeah, we have trainings on doing radon investigations, including an on-demand online course for those that want to get into more detail. There are sensors that are coming on the market that will do radon. One of the sensors I showed in the presentation actually does do radon detection. You need to be careful to make sure the device you're using is adequate for making expensive decisions, because if you have high radon, you're going to want to do mitigation. That's not a cheap thing to do. So you want to make sure you go through your QA/QC procedures to make sure you're doing good testing and have good data to make these decisions. And at ITEP, we're happy to help you with that. And Lucy, I see that you're on. Thanks for joining us. And Lori, I see you put in your email. I'll get that captured so that we can put you into the drawing. Any other questions?
I'm seeing one. I'm wondering if, David, you might be able to help. It seems like a technical question on how the participants can access the presentation materials.
Yeah, so there's a couple methods. One, we are recording this, and it will be on the website, on the actual tribal conference website at a later time. I don't know if someone wanted to provide an email. Maybe you can directly send it to Ted, or again, they can check it out later at a later time.
Yeah, so we have the presentation PDFs posted to the web page. I think once the broadcast is finished, you'll be able to see previous sessions. And if you go to watch recording, there's a section where you can download the PDFs.
And
I think we have one more question from Sonia.
Yeah, Sonia's asking about different types of radon tests, and actually there's far more types of radon tests than we have time to talk about today. There are test kits that might do 48 to 72 hours. There's also ones that'll do up to 90 days and everything in between. So if you do have specific questions about test devices for radon, my suggestion is to email me, and we can set up a discussion to discuss what your situation is and what kind of tests might work best for your particular situation. And I put my email in the chat, so feel free to email me and we can discuss the different options. And there's probably more than one that would work for your situation. So, but it's helpful to know what your situation is. And I, for one, need to leave for another session, but I want to thank both my co-presenters and our audience today for participating in our session. And feel free to reach out to any of us for more information and help with your air quality issues. Thank you.
Yeah, thank you, everybody. It's good to see everyone.
Thank you so much. Goodbye, everyone.